just full of smiles today, Sarah, because we have with us our friend Guilherme Rabello. And Guy is an engineer from the Escola Politécnica Sao Paulo University in Brazil. And he has more than 25 years of experience in the telecommunications sector. Since 2011, he's worked in the healthcare area, developing solutions in telemedicine and medical innovation. He's head of innovation at Inova Incor in Sao Paulo. He's coordinator of the Patient Blood Management Project at the Brazilian Association of Hematology and Hemotherapy. He's so busy. He's a member of the executive board of one of our favorite groups, the Sociedad Ibero-Americana de PBM. He's the Ibero-American coordinator and vice president of the Brazil chapter. And he's coordinator of the Innovation Center of Cardiology Society at the state of Sao Paulo. And he's a member of the Society for Advancement of Patient Blood Management. And he's also an MBA professor in health tech and health innovation. He's just such a busy man.
Oh, we're so glad to have you. You know, I heard a lot of things in that bio, and you certainly are doing a lot for patient blood management. But one thing I did not hear is a clinical background. You're not a physician. You're not medically trained.
Yes, it's. I think it's unusual.
Yes,
but it's something that I believe contributes a lot to the patient blood management community to have somebody from the outside world of the clinical environment.
No matter what your profession is, what your schooling or training is, you might have a role to play in this patient blood management movement.
Definitely.
Yeah. How did you get involved in patient blood management, Guy?
Well, many years ago, I have a friend that asked me to help him. He didn't speak very, very good English, to find out some treatment options for a family member. And when I was digging on the internet, I found out about some hospitals in US that had some bloodless service, and I figured out that it was very interesting. I never heard about. So I was helping this friend, translating materials and so on, and started to study it. And suddenly I was hooked. I said, well, this is something very interesting. I started to question how this can be done, what's the process involved, and things that an engineering mind always have, right? How to put pieces together and make it work. So it started as this intriguing situation, and I started to do my personal study on this. And later I found out it became also known as patient blood management. And I found out about the Society of Advanced Blood Management, the SABM, and start to figure out, oh, well, maybe are they going to accept someone that is not a medical professional? Well, they did. And in 2015, I went to an event in Orlando and did my certification on patient blood management. And that was a good start, together with my move from my original career in television to become part of the medical community when I migrated in 2011 to do telemedicine.
Well, I'm so glad that patient blood management accepts all disciplines. You've really become a mentor to implementation, and you've had great success. We all kind of are looking up to you, and you're leading the way for sure. I'd like to learn more about how the engineering approach to patient blood management is different and is successful.
Mm-hmm. Well, Sarah, this is a very good point, because when I started to work with doctors and nurses and all the people from the medical community, what happened is I figure out that you are very talented and educated to do tasks. You are instructed to follow protocols. Patient blood management has the M, management. And management has a different set of skills, and not management of one single task, but from us in the engineering, we see the overall picture. we usually deal with complex scenarios. It was important for me to figure out that I had some skills and background on dealing with complex cases, management, production, processing, projects, management. So it was a good fit. When I started to talk with the doctors and nurses and so on, I started to see their own challenges from a different point of view. I didn't have the same need to complete their tasks. I had other challenges to complete my tasks on making it fit together. So I like to solve puzzles and put pieces together. So like what engineering does, I think it was an interesting approach. It's not common to have engineers in the medical field doing patient blood management. I don't know, maybe I probably would be the first to do. But it's good to have engineers in the health business because we have a lot of technology, a lot of things to be put together. So it's complementary work.
Yeah, I know you've talked to us a lot about systems thinking and how movement on one thing, one small thing, can affect the movement all the way through the patient experience and the patient process. And I think sometimes in the medical world, we're siloed into specialties. You know, we're working in one specialty, but our patients cross many of those specialties when they are dealing with a health care issue. And so I think that's some of the problem we have is being siloed. Tell me a little bit more about systems thinking and how you've applied that in organizations so that everyone is more on board.
Yes. Yeah, that's a good analysis. That's the type of thing that I always look and see. Instead of the silo, that is when you think tank something in a small environment. From my perspective, it's like putting industrial plant, things that moves, pieces that moves, and needs to be integrated on systems that are engine designed. So when I see patient blood management and all the things that have to be done, and the pillars, the 3 pillars, and so on, I see engines. I see pieces that are integrated in a motor engine that needs to be well designed, well fit, and working together. So I always see this systemically. So if patient goes into the hospital door, how he get out of the hospital door, and how he goes through a nice workflow, how things move from one area to the other seamlessly. And this is something that every hospital around the world have as a challenge today. Even the biggest and the better ones, they are still in lack of improving the process. On talking with colleagues now at hospitals and at the societies and so on, is what kind of pieces we are being able to increment on the PBM puzzle. And that's an excellent challenge that I have every day.
Yeah, what are some of those challenges that you see commonly?
I think that as every hospital needs to treat their own type of population that they have around them and to the type of specialties they want to be very good at. Patient blood management is not copy and paste. Far from it. It's much more complex. It's almost like a living organism that you need to handle, especially because patient deals with culture. So when we talk about patient blood management, the patient is culture, and when we're dealing with different people, we need to have different approaches. So it's a very interesting way for you to organize a program, different behaviors there, either from the patient itself or for the people that are providing the service. On the blood, we have the technicality. So we need to see blood and organs and machines and drugs and medications. It's all the tools in the garage. How we manage this correctly. And when put the management is the data, is how we organize information, the flow, how we communicate, how we interface with different people at different time and in an organized manner. So I see all these pieces working together like a spine. We need to put this in a way that it holds, it stands up, and not deorganized silo that is most of the time when we see people complaining is that you are getting into an organization and from department to department, it feels that you are being in a different organization.
In one of our conversations, I thought it was a great example of how you've tried to bring systems thinking into a hospital system and engage the clinical staff to become interested in patient blood management. And you did this very cleverly. Can you give us an example of how you worked with the clinical staff to get them to understand that patient blood management is not just a hematology consult, that it affects everyone?
One of the things that we used to attract the clinical people was doing some sessions of design thinking with them. So we used methodology that are usually done in the technology market or marketing people. We brought this to them to do a design and do a multi-professional, multi-speciality approach. So to have a team build with them. And it was interesting because they were all leveled during this design. At our hospital in Sao Paulo, provided to them a proposal that patient blood management should not be a project from the clinical side, but from the innovation side. So we started the patient blood management project at the hospital as an innovation initiative because we wanted that everybody felt that they have a role of being an innovator on providing patient blood management. So, as an innovation, you cannot do the same things all alone. You need to increment, you need to disrupt, you need to do some leap stages. So they were entitled to think outside the box. So all of this created, I think, an identity with them regarding the challenges. So they were provoking their own thinking, saying, yeah, how we can do this differently. If we take out this piece, what should we do? Or if I don't have blood available, what should I do first? So we were always provoking them, saying, yes, you need to innovate your way of thinking. It was very good because they were not felt under the conditions to continue to express the same conservative thinking, but they were able to allow different ideas to flow around. So it was the Lego pieces coming, right? So they were exploring different pieces to see that we can build different solutions for patients with different approaches.
That's so valuable.
I don't know if it was something, yes, I don't know if it was this that I mentioned to you, but since we talked so many
I know
things,
we have.
I think it
I
was
was
one
thinking
of them.
about the time that you walked around with clinical staff and you had a point of care test and you had them all take they
Oh,
sampled
yes,
their blood and they found out several of them found out
yes,
they themselves were anemic,
yes,
just showing how patient blood management impacts them on a daily basis.
yes, yes. They were on the other side, right? So this was last year when we were doing the World Anemia Awareness Day. So we brought a small device that is a point of care for our fingers, like oximetry, but it measures the hemoglobin. So first it was an intriguing thing because people never saw the device before, so they wanted to try. So like a kids, right? It's a new stuff. So I wanted to try. And they were at their regular day of work. So the nurses, the doctors, they were at the ICUs, they were at the ambulatory infirmary, they were at their regular place. So we went, it was a small group of the hospital. We were promoting the Anemia Awareness Day. So we were walking around and say, do you believe you are anemic or not? Some of them, because of their previous history, said, yes, I believe so. My doctor says that I have to try and so on. So we put it on the finger. Yes. And they were said, yeah, I have this. So I said, yeah, treat your anemia. So we were sending them to the hospital staff clinic. But some of the people, they were not aware. They said, yeah, I was a little fatigued and so on, but this because I'm tired. But when they saw the measurement on this small device and they figure out and said, wow, I need to take care of this. They said, yeah, now you are not a nurse taking the measurement, you are the patient. So they felt this very clearly. So they saw how anemic they were. And it was not a blood draw, it was something that was on the finger. So I saw that from different approaches, Sarah and MaryAnn, that can be provocative to the mind and very easy and fast and cost almost nothing, one of these devices. We could make sure that almost these 200 people from the hospital that we had the chance to impact, they were not the same. They said, yeah, if I'm not anemic, I need to be taken care. But if I am, I need to be taking even more care of this state. That's how we told them, yes, imagine now about your patient. So it was a good start to discuss. And some of these people came back and said, how can I help?
I think it's great how you've been able to kind of prick people's interest and then get us out of our protocols, because our protocols and our guidelines are very important and we think on them every day. But we also do need to be thinking about innovation and becoming better. And so I love that you've brought this, to your systems. Are there any current projects that you're working on, and how are they going?
From medical societies, I have to work to support the Brazilian Hematology Society to provide the content to help hematologists, hemotherapists, blood work people with the understanding of what patient blood management is. So we released last October patient blood management consensus from the Brazilian Society. It was a major achievement, and it was already in sync with the World Health Organization message. So our whole development of the content was following the World Health Organization policy brief. Also, I'm working with the Ibero-American Society for Patient Blood Management that you know very well. We are helping to organize activities in almost 20 or something countries, from Mexico down to Argentina and even Portugal and Spain. And they are Spanish and Portuguese speaking countries. And we are very much alike. We are different from US, from Canada. We are more Latin countries, middle to low income countries. So we have different approaches, and many of our countries provides as a general solution public health service. So we have different approaches and needs for patient blood management implementations. But I am also working now to consolidate from the Brazilian Hematology Society some work with other specialty societies in Brazil that can, with a synergy of work like anesthesia, gynecology, obstetric, intensive care, blood marrow transplantation, and others. We are trying to work in harmony to provide unique vision of patient blood management to Brazil, because this is something that I believe provides a better outcome as educational and efforts from all these societies together to implement faster and consolidate on a better harmony way the patient blood management vision. And finally, right now, I'm very happy to be collaborating also with the SABAM annual meeting society organization for this year, 2024. It was a first experience, and I hope to be able to give some help in the activities they are discussing for the next event.
I'm so excited about that too. And I like to repeat a point that you've made throughout here. You know, many of us came into the patient blood management world in different ways from different specialties for different reasons, right? I mean, that's just, it is how it is. It's such a challenge when you're working with different specialties and different societies and nurses and engineers and doctors. You really have to keep that spine in place, right? You have to keep the focus on the World Health Organization definition and keep everyone on the same page, right? That's a challenge in itself. So kudos to you for being so organized and while being innovative, keeping everyone on the same path and not just reinventing the wheel all the time.
I think this is very important, MaryAnn, because it also consolidates the message we want to give either to the professionals, but also to the patients. Patient blood management may have some flavors, but it cannot be different food.
Right.
Okay? So
right.
we need to be consistent and have an harmony regarding what we are talking about.
Yes.
This coordination work is less of to be proud of being the leading organization or association or specialty, but it's more on the modest and humility to say how we collaborate to be giving a consistent, consolidated, and reliable message. Suppose a patient wants to understand about what he's going to get as a patient blood management service from a hospital, and it differs from place to place. So is he going to trust this type of a service? No. He may understand that differs maybe from the specialty, the people, the size of the hospital, the complexity of the service. That's fine. A cardiac surgery is not always the same. It depends on the issue you have to fix. But he cannot think that he's going to a cardiac surgery and someone operates his feet. So it needs to be consistent. And that's why we are working so hard on SABAM and in the Brazilian associations or in these Ibero-American, as we need to help the professionals and the population to understand that patient blood management has a spine. It's something that holds everything together, that makes us stand up and secures the load of doing the management of the patient on their own blood. And even though the characteristics that we apply differs from patient to patient based on his needs, it's something that they understand. It's consistent to the whole perception of patient blood management is all about.
So thankful to the World Health Organization and all the people who have worked with them to really develop that spine, that definition that can be defined the same way globally in all hospital systems around the world, so that we know what we're talking about and we know what our goals are.
Mm-hmm. Yep.
Yes.
So, yep.
Yeah. And also it's important because if we have the same understanding, for example, the outcomes, the data, the measurements, the results, how we can improve, it's going to have the same scale, right? Because we are talking about the same things.
Mm-hmm.
And this is important. Just to bring something that is very curious, some years ago, there was a disaster in the space when NASA sent a satellite to look into an asteroid. And then when the satellite was getting close to the asteroids, something went wrong and it didn't reach the asteroid like it should. And they were figuring out where did we missed.
Mm-hmm.
And they found out that they mix the measurement of the distance. Instead of doing in meters, they did it in feet. So the calculation was done wrongly because they were different
Yes.
measurements.
Yeah.
So are we going to do the same in PBM using different scales?
Right.
We are going to miss the satellite. We are going to send it somewhere and it's going not to achieve
Yeah.
the goal. So I think
Yeah.
that our work now is not only to development the solutions and the management and the workflows and so on, but make sure that everybody that is involved, from patients to professionals, understand that we have the same scale. We are talking about the same measurements, talking about the same things. So there is not misunderstanding.
Very good.
Would you encourage others who are engineers or non-medical folks to become involved in patient blood management?
Definitely. I think it's a must now. And we should bring, either as societies or PBM specialists, professionals like we are now, different people from different areas, like marketing.
Mm-hmm.
We need them.
Yes.
How we are going to produce better content, nice pictures, infographics, video that talk to the people that are more layman on things, that they don't want to get the face say, I didn't understand a word that you said to me. We need people from other areas that even that they
It's
don't
true.
understand too much, they start doing the questioning that we stop it to do to ourselves.
Yes.
It's very important to have it. And part of the innovation that is my area now of activity is we need to have different voices. If we want to have every voice heard, we need to have different voices. And in the medical societies and medical fields, we were used to have very few voices. We want to patronize, to be more of the parent that believes, understands everything for the kids. Yes, sometimes we have this role, but today it needs to be more inclusive. So, MaryAnn, it's our mission to have more people from different venues helping us, even if they are from the patient side. Why they shouldn't be there? They should be
The
there.
most
That's
important
why the
voice.
PBM is
Yep.
there. It's the patient, right?
Right.
So what they want, what they think we are not doing right, what we are missing, where we can do better. So it's important to have different voices, more voices.
There you have it, audience. Everyone has now been invited by Guilherme to,
Yeah,
if you have interest, please get involved in patient blood management. We need your voices, we need your thinking, and we
that's
need your
real empowerment,
solutions.
right?
Yes.
It is.
Yes.
It really is. Guilherme, we've had a great conversation with you. I'm taking away so much. What would you like to leave our audience with?
First, I just wanted to thank you, Sarah and MaryAnn, for the invitation to be here. And I have been following the Let's Talk PBM podcast. It was a great idea. It's not just another podcast. It's, I believe, the only one that talks about PBM. And we should promote more of this type of discussions, free discussions. In the scientific world, we are a little bit afraid to talk without data, but we can share ideas. So there are space for us to share ideas, and we should do more on the topic of patient blood management. My incentive here is, if you are listening to this and you are a professional that do not get too much involvement on patient blood management, do it, because you are going to be a patient one time, and you want to get the best people with patient blood management minds treating you. If you are a patient or someone that believes can help, get involved. It's easier for us to demand, but it's more satisfying when we contribute. So let's do it together.
Beautifully stated.
Love that. Thank you so much for joining us. And we really look forward to seeing you again in person very soon.
Very soon.
We hope you enjoyed this conversation and found some takeaway or new thought that improves your health. We would love to hear from you. Feel free to reach out to us on our website if you'd like to see what we're up to. Our website is letstalkpbm.com. If you enjoy our conversations, please like and subscribe wherever you listen to podcasts and on our YouTube channel.
Special thanks to our guest and our producer, Delaney Coronado, and the entire production team for all of their expertise in content creation, technical abilities, and dedication to our message. We appreciate the experts who drive this medical movement forward, and our affiliate partnerships who support the work that we are doing. Until next time, stay connected to your blood health.